Good evening. This is Maritere Rivas with RNTV, Channel 23 News, and we're coming to you live with an important story about a medication error that recently took place in Middleton Memorial Hospital. This event has raised many questions about patient safety, and tonight we are joined by experts who will help us better understand what happened, why medication errors occur, and how they can be prevented. So joining us now is David Rowlett, the Chief Nursing Officer at Middleton Memorial Hospital. David, thank you so much for being here today. We are also joined by two representatives from the State Board of Nursing, Elizabeth Perez and Daniela Velasquez, who will provide valuable insights on the regulatory side of nursing practice. Thank you all for being here.
Thank you for having us, Mary. I want to stress that our hospital is committed to ensuring the highest level of patient safety. This incident is something we take very seriously.
Thank you, David. Can you tell us what happened at Middleton Memorial Hospital and what led to this medication error?
Certainly, in this case, a registered nurse made a mistake during medication administration. The nurse accidentally administered the wrong dose of insulin to a patient.
It sounds like this could have had serious consequences for the patient. Why was this medication administration classified as an error?
In this case, insulin is a high-risk medication, and even a small miscalculation can lead to life-threatening complications such as hypoglycemia. The nurse administered a dose that was higher than what was prescribed, and that's why it's considered an error.
How did this error occur, and what was the chain of events that led to this mistake?
The error happened during a very busy shift. The nurse was distracted by an urgent matter with another patient, causing her to misread the unit measurement on the syringe. There was no secondary verification or double checking of the dose before administration.
So it's clear that this was a chain of events that compounded the risk. But David, how could the nurse have ensured patient safety before or after this error occurred?
First, before administering any medication, the nurse should always follow the 5 rights of medication administration and double checking the medication dosage with a colleague or a secondary system, especially for high-risk drugs like insulin, is critical.
So it seems that clear communication and double checking protocols could have prevented this from happening. Finally, David, what steps is Middleton Memorial Hospital taking to ensure that medication errors like this are minimized in the future?
We are taking this incident as an opportunity to reinforce our safety protocols. We're implementing additional training for our nursing staff on medication administration and encouraging the use of the 2-nurse verification system, especially for high-risk medications.
Thank you for those insights, David. It's reassuring to know that Middleton Memorial Hospital is taking proactive steps to improve patient safety. This has been a helpful reminder of the importance of vigilance when it comes to medication administration. David, can you explain what constitutes a medication error in a hospital setting?
Sure, Mary. A medication error is any preventable event that may cause or lead to inappropriate medication use or patient harm. The most common type of reported medication errors are wrong dosage and infusion rate.
That sounds serious, but who is responsible for ensuring medications are safely administered in a hospital?
Nurses are primarily responsible for the administration of medications, but physicians and pharmacists also play important roles in prescribing and ensuring safety.
Thank you for sharing, David. Let's bring in Elizabeth and Daniela from the State Board of Nursing. Daniela, how do you view the role of regulations in preventing medication errors? And Elizabeth, can you explain how the board ensures that nurses are held accountable in cases like this?
Absolutely. As a State Board of Nursing, we set and enforce standards that help to prevent medication errors. These standards include requiring nurses to complete more education on medication safety, ensuring they follow hospital protocols, and educating patients on medication safety. We also help shape policies that encourage safe medication administration.
That's right. So our role is to review if the nurse involved followed the right procedures and if this was a situation that we could prevent. Depending on the situation, the board may take actions such as furthering education or more serious disciplinary measures if there's evidence of incompetence. Overall, the goal is to ensure patient safety.
Thank you for that valuable insight, Elizabeth and Daniela. Returning to David, what are the rights of medication administration and why is it so crucial for nurses to adhere to them?
The rights of medication administration are essential. The right patient, the right medication, the right dose, the right time, and the right route. These rights are crucial because they prevent errors that can lead to severe patient harm.
That's right, David. From a regulatory standpoint, ensuring these rights are followed is absolutely non-negotiable. If a nurse fails to follow these rights, they could face disciplinary actions from the State Board of Nursing. The right process and safeguards are in place to protect both patients and nurses.
That's why it is important that nurses continue their educations on these rights. Compliance with these rules isn't just for patient safety. It is part of maintaining a professional standard in nursing.
Now, David, what are the potential risks that medication errors can pose to patients?
Medication errors can lead to adverse reactions, allergic responses, organ damage, prolonged hospital stays, and sometimes even death. That's why prevention is so important.
What are the roles of nurses in prevention of medication errors?
Nurses can use barcode scanning systems, practice medication reconciliation, and regularly participate in safety training. They also need to communicate openly with the rest of the healthcare team.
The board also strongly supports these strategies as they align with our standards. We also encourage hospitals to create a culture where nurses can report near misses or errors without fear of punishment or retaliation.
Absolutely. It is critical that nurses are up to date with the latest and best practices in medication administration. The board mandates continuing education and enforces regulations to ensure safe practices are upheld across the state.
So when a medication error happens, what is the procedure to follow?
If an error occurs, the nurse must immediately notify the healthcare team. Then a full investigation is launched to understand the root cause and corrective actions are taken. It's important that we all learn from these events to avoid recurrence.
And as part of our regulatory process, we are constantly monitoring how these errors are handled and followed up to ensure the appropriate actions are taken in response to such incidents.
We also encourage hospitals and nursing facilities to report errors to the state board so that we can track and identify any issues that might need addressing.
Well, thank you all for this valuable information. It is clear that medication errors are preventable, but it does take teamwork, vigilant practice, and regulatory oversight to protect these patients. Nurses have a crucial role in preventing these errors, and the State Board of Nursing ensures standards are maintained to keep everyone safe. Once again, thank you to all our guests tonight. It's been an informative discussion. For more information about safe medication administration and resources for nurses, visit our website at www.rntv.23.com. This is Maritela Rivas signing off. Thank you.